Dr. Desmond White, today I want to talk about one patient that went for a screening ultrasound by his screening center doctor, and ultrasound found there was a solitary liver nodule, and he was referred to me for workup. So as a liver doctor and gastroenterologist, we will approach it this way. First, we do not routinely do an ultrasound scan of the abdomen unless there's a reason. For this particular patient, he did a screening ultrasound at the screening center, and it showed there was a 2 cm nodule in the liver. How did we approach? Number one, we want to assess the chance of this lesion being something bad, like cancer. So we will ask the patient about any risk factor of liver cancer, such as hepatitis B, hepatitis C, liver cirrhosis from any cause, overweight that may lead to fatty liver and liver problem, and chronic alcohol consumption. If the patient has any one or more of these risk factors, it can be a red flag that suggests that this nodule may be something dangerous like a liver cancer. But most of the time, my patient will have no risk factor. If there's no risk factor, I normally tell them if you have no risk factor for liver cancer, the liver cancer is unlikely. So that will give me and the patient some calmness. Second thing, I will look at the scan to determine whether this nodule is truly a solid or liquid nodule. On the ultrasound scan, a solid nodule looks more bright, whereas a liquid nodule, or what we call cyst, contain liquid, it will be black. So if this is a black color stuff, then we know it's probably liquid, it's probably liver cyst, and it's not important. But if it's a solid nodule, then we are more concerned because liver cancer are not liquid. Liver cancer is a solid nodule. So we assess for the risk of liver cancer, we assess, make sure that it's a solid nodule, and then we will discuss with the patient the option. Number one, what are the possibilities? The most common solid nodule in the liver is something called a liver hemangioma, which is in layman term a bunch of abnormal blood vessels in the liver, and it's almost like a birthmark. Some people have birthmark on the face. My patient with hepatic hemangioma will have a birthmark in the liver. It's a bunch of abnormal blood vessels, it is okay. Other benign lesions include focal nodular hyperplasia and other benign nodule like adenoma. Liver cancer in a patient with no risk factor for liver cancer is very uncommon. So I normally give the patient two options. Number one, if you're not concerned and the risk of cancer is low, we can do a follow-up ultrasound scan 4 to 6 months later. That's because liver cancer will double the size every 4 to 5 months. If the patient have a liver cancer, in 4 months' time, it will increase its size from 2 cm to 4 cm. Another option would be if you're very concerned, then we can proceed to do an MRI of the liver. MRI of the liver is the most comprehensive, it's most accurate, it's more accurate than CT scan. So that was my choice, this is my option. After CT scan, we know what exactly it is, whether the FNH or hemangioma, and we can deal with it accordingly. I would say most of the liver nodule diagnosed on screening are benign, they don't cause any harm. We only worry if there's a risk factor for liver cancer, such as hepatitis B or liver cirrhosis, or the lesion increases in size. Say if today is 2 cm, 4 months later it's 3.5 cm, we'll be very worried. So to sum up, liver nodule is common in routine ultrasound. For that reason, I do not recommend people to do an ultrasound scan of the liver unless there's a good reason to do so. And most of the time it's benign. If a person has no risk factor for liver cancer, most of the time the nodule is benign. And if the patient is anxious, we will do an MRI scan up front and we can know the nature of the lesion and manage accordingly. I hope I have erased your worry, Dr. Desmond White.